morning. Today we dive into the topic of inherited disease in dogs, the judge's role in protecting breed soundness. So, good afternoon, ladies and gentlemen. Today's session focuses on inherited disease in dogs and, more importantly, the judge's responsibility in recognizing soundness and discouraging exaggeration in the shearing. Let me begin by clarifying one essential point. Judges are not veterinarians, but judges are guardians of breed health. Your decision influences breeding choices, and those choices shape the future of every breed. Why inherited disease matters in the ring? Selective breeding has given us distinct breeds with predictable type, temperament, and function. However, when selecting breeding focuses heavily on appearance, especially exaggerated traits, it can unintentionally increase inherited health problems. As judges, we must remember, what we reward today will be bred tomorrow. Soundness, moderation, and functional anatomy must always underpin breed type, breed size, and structural risk. Let us first consider large and giant breeds. These breeds are statistically more prone to joint and skeletal disorders such as hip dysplasia, elbow dysplasia, and degenerative joint disease. In the ring, you are not diagnosing these conditions, but movement tells a story. When judging, look for free, effortless, balanced movement. Be cautious of excessive bulk or heaviness. Penalize restricted, labored, or uncomfortable gait. A dog that struggles to move cannot be considered functionally correct. Now turning to small and toy breeds. One of the most common inherited issues here is patellar luxation, which often reveals itself only in motion. When judging, observe rear stability carefully. Watch for skipping, hopping, or uneven stride. Do not be distracted by excessive showmanship. Soundness must always outweigh presentation. Brachycephalic breeds, judging for moderation. Short muzzle breeds present one of the most important welfare challenges in modern dog showing. Excessive shortening of the muzzle can lead to breathing difficulties, heat intolerance, and reduced stamina. In the ring, audible breathing at rest is undesirable. A correct head must still allow normal respiration. Moderation is essential. Exaggeration must not be rewarded. A dog that cannot breathe freely cannot function correctly regardless of type. Skin wrinkles and functional fit breeds with loose skin or wrinkles may be prone to chronic skin and eye problems when exaggeration is taken too far. As judges, skin should be functional and breed appropriate. Excessive folds that compromise comfort or health should be penalized. Remember, utility must always come before excess. Eye disorders and breed type. Inherited eye conditions such as PRA, cataracts, and eyelid disorders are often linked to extremes of eye shape or placement. While many eye conditions are not immediately visible, exaggeration increases risk. Judgment emphasis should be placed on correct eye shape and fit, avoiding extremes that predispose to the irritation or injury. Breed versus bloodline. An important distinction must be made here. Health problems are often line-specific, not universal to an entire breed. The overuse of popular sires can intensify inherited issues within certain bloodlines. Each dog must be assessed by individual merit. Reputation should never outweigh soundness. Health schemes and breed welfare organizations such as the Kennel Club and the British Veterinary Association have introduced health schemes, including hip scoring and eye testing. While judges do not enforce these schemes, judging trends strongly influence whether breeds follow them. The judge's ethical responsibility every exhibit you place sends a message. Reward balance and moderation, penalize exaggeration, prioritize functional soundness. A dog that cannot move freely, breathe easily, or function correctly cannot be considered truly excellent. Soundness equals correctness. Moderation protects welfare. Exaggeration must never be rewarded. Every judging decision shapes future breeding.